Will Deb Matthews' announcement from this past Monday affect patients' care? Speaking specifically for ophthalmology, in my opinion, unfortunately, there's no doubt that it will affect patient care. The main crux of where this may be a problem is there are certain tests we need to do on a very regular basis to make the proper diagnosis and to monitor and make sure the patients are responding properly to treatment, so we make decisions about whether the patients need another treatment or can skip a treatment. So again, the announcement of fee cuts for physicians and limitations on the number of tests we can do, so the fee cut to the diagnostic reimbursement and the limit on the numbers will impact our ability to treat patients optimally and according to the best scientific evidence that's out there. Physicians have gone out personally and purchased these expensive diagnostic pieces of equipment in order to allow their patients the optimal care because there's an ever-aging demographic, there's more and more patients who require this test, and the publicly funded healthcare system can't afford or provide all the diagnostic testing facilities that's required. So this type of a cut, again, will clearly negatively impact how we can deliver the care, and that translates into visual loss for patients. The alternatives for our patients are they're either going to have to seek their tests outside the healthcare system, so either from optometrists who are permitted to charge for the test, or they'll have to go out of the province to get the test and again pay out of pocket for the test. Studies have shown that if patients have to pay for any portion of their healthcare system, they may shy away from getting these tests done, and that would result potentially in patients losing vision. The specific disease entities that will be most affected and most impaired by the proposed cuts are diabetic retinopathy and macular degeneration, and also venous occlusive disease, or diseases of blood vessels inside the eye. Diabetic retinopathy is a disease where over time diabetes has a tendency to cause damage to blood vessels. It can make abnormal blood vessels grow, which cause bleeding, or can cause regular blood vessels to start to leak, the retina gets soggy, and the patients have difficulty seeing. Macular degeneration is a disease of the elderly, anybody, predominantly patients over the age of 50, but increasingly prevalent in patients who are 60, 70, and 80. Both of these conditions are sight-threatening conditions, and again, macular degeneration is a disease of abnormality of blood vessels. And so the treatments that we do, fortunately, that have evolved over the last 5 years, have revolutionized the treatment. Whereas in the past, many of these patients would go blind, the treatments that we have now with injections of drug and monitoring for response to injections, these treatments that we use now are miraculous. And we have many patients preserving or even having improvement in vision thanks to these drugs. In order to apply these drugs and to monitor the drugs and know that we're giving the right dose, the right amount of drug, that they're responding well, that we don't have to switch to another drug, we need to do these testing that needs to be done more than 4 times a year, specifically for retina diseases. 2 specific tests that we're talking about. One is called OCT, or ocular coherence tomography. It's a test where we can actually visualize, do a topographical map or a surface map of the retina, and know when the retina is swollen, know when there's fluid under the retina, know when there's scar tissue under the retina, know when things are distorted at a microscopic level that we just couldn't do 10 years ago. And this has greatly enhanced our ability to diagnose disease, monitor response to treatment. This has radically changed medical care for the better for the patients. Another test that's very frequently done in ophthalmologist's office is a visual field. This is a test that looks at someone's peripheral vision, and especially for diseases like glaucoma, but also for neurologic conditions, for tumors of the brain. It's critically important that we can document with these tests and see where the abnormalities are, and in many cases spare the government the expense of expensive MRIs and CT scans. The government's announcement will force us to limit the number of tests that need to be done. But in order for patients to get the optimal care, we will need to have access, we will need to have the ability to see how they're doing at each visit through these diagnostic tests. If the patient is seen 9, 10, 11, or 12 times per year, on each of those visits, we will have to make some arrangement where they go to another site, to a non-physician, non-OHIP physician, optometrist, or potentially a diagnostic treatment center, and they will have to pay for that test, or their insurance company will have to pay for that test. But asking us to try and provide care without having all the information, we're not eager to do, because we've learned from the past that these tests allow us to provide the best possible care, and anything else would be taking a step backwards. My personal opinion is that we all recognize that we're in a difficult time economically. We realize the government is facing budget pressures, and we want to help and can help the government, but I think the cuts they're proposing are being placed in the wrong place. We wish we would have had more of a dialogue with the ministry, because I know that we could come up with ways to save lots of money without in any way compromising patients' eye care.